Hello, my name's Leah, and I am the physician assistant here at Beth Collins, MD Plastic Surgery. So today we're going to go over kind of expectations and post-op care after a facelift surgery or any facial surgery to kind of explain how to best take care of your incisions and the do's and don'ts after surgery. So the first thing to kind of start with is there's a couple things to note the night before surgery and the day of surgery. So the night before you will wash with a special, it's a HIPAA it's a special body wash, and you're gonna wash from head to toe. Try not to get it in your mouth or eyes, and then you're going to do the same thing on the morning of surgery. You will also refrain from drinking or eating anything after midnight the day before surgery. So you'll come to the OR without any, a clean face, no lotions, makeup. Try to refrain from false lashes, nail polish, and then you're going to dress comfortably. And then after surgery, you will wake up with a head bandage on. You're gonna leave the head wrap on until you see us the next day. So you're gonna follow up in the office on post-op day 1, that very next day after surgery. Make sure you have someone to pick you up from surgery and be with you the first few days, and they will need to drive you to your post-op appointments. We usually ask patients to not drive after surgery until they feel like comfortable that they could be a defensive driver and that they're off all pain medicine. So usually that takes about a week or so after a facelift surgery. So you will come to the office on post-op day 1 and we will remove your head wrap. So we will do that for you and reveal your gorgeous, beautiful results. You're gonna love it. And in terms of where you will have incisions, it kind of starts up in the hairline, goes behind the ear, and then it's hidden in the back of the ear there. So you'll have some incisions kind of in this area that are discreetly hidden, so you can't see them. And then there's gonna be one incision under the neck here that is also hidden kind of in the crease under the neck. So you'll expect to kind of have sutures there. We keep those sutures in for 10 days. And then on post-op day 10, we will have you come into the office and we will remove those sutures for you. I would plan for the suture removal to be in the office for about an hour. And so on the first day after surgery, you're going to expect to have lots of swelling, lots of bruising, and that will continue to get better over the first week. And then in terms of incision care, you're going to want to keep some ointment, which would be some Aquaphor, Vaseline, whatever, just pick up some sort of ointment. Bacitracin will sometimes have patients use any type of ointment, and that's going to keep the incision protected and moist so that it creates a good healing environment and you can get the best scar possible. So you'll put a thin layer of ointment just on the incisions here. You're going to refrain from makeup for the first 2 weeks, 10 days to 2 weeks. And then you can, after we take your head wrap off, you can take a shower when you get home and wash your hair and everything if you're feeling up to it. If not, if you're still feeling like you're not wanting to do much after surgery, just shower the next day. And then just using gentle soap and water in the shower, you can wash the incisions gently. You don't want to rub too hard where you have like the sutures, but you can clean the incisions, clean your hair. And then you will place after the shower, dry off, place the ointment on the incisions. You're gonna place ointment on the incisions 2 to 3 times a day to avoid the incisions drying out. So then on post-op day 10, you'll come in, we will remove the sutures. At that point, a lot of the swelling and bruising has gone down. And usually, rule of thumb that we kind of give for expectations post facelift surgery is that 2 weeks you're gonna want to hibernate and not plan any social engagements, or turn off the camera during a Zoom meeting, or just kind of be out of work for the first 2 weeks. That's when you have the most swelling and bruising, which is completely normal, but you want to give it time to go down. And then about 3 months out is when patients are picture ready, event ready. You will look great before that 3-month mark, but things continue to settle and change, and a lot of like lingering swelling will subside by that 3-month mark, and then things continue to change from there on out. 6 months and a year, the result just keeps getting better and better. But in terms of planning downtime, that's kind of our rule of thumb. And then in terms of activity level, you want to refrain from any high impact exercise. You want to try and keep your face, your neck from turning too much, and keep a 90-degree angle between where the neck and the mandible. So keeping a 90-degree angle is important after facelift surgery, especially in that first week to 10 days. In terms of diet, we usually encourage to stay hydrated and to eat lots of protein, but you're gonna wanna stick to bland foods. Nothing super spicy, nothing that's too acidic. So no citrus or anything like that. And try to keep to a lower salt diet as well. So and then we also ask to refrain from coffee if you can, because that does tend to be a little acidic as well. For sleeping, you'll want to actually sleep flat after facelift surgery, which is a little different than you might expect, but that will help the swelling go backwards and kind of out of the face. So you'll sleep flat for the first week or so if you can tolerate that. Definitely sleep on your back. There's no side sleeping in the first couple weeks after surgery as well. After we remove your headdress that you will go home in after surgery, you will notice that there will be some sutures kind of on the neck area. We're gonna have you come back on post-op day 2. So we're gonna see you the first day after surgery, and then we're gonna see you the second day after surgery, and that's when we will remove the sutures on the neck. The purpose of those is to prevent any fluid collections. It helps us not have to place a drain. Some patients may or may not have a drain placed after surgery, but more likely you will just have some suture, kind of netting suture. That's removed on post-op day 2. And then at that appointment, you will be given your own head compression garment that we will have you start after those sutures are removed. So in terms of, and you're gonna try to wear the compression garment as much as you can for the first couple weeks. If the idea is it will help with swelling, but it also helps the skin and tissue heal up towards the jawline, which is what we want. We want a nice sharp jawline after facelift surgery. So it just Velcros to itself, and you can adjust how much compression is comfortable for you, but you do want you do want it to feel supported and have a little bit of compression there. Obviously, if you're out in public or at work, you can take the wrap off, but try to wear it as much as you can in the beginning. If you decide you're going to have upper or lower lid surgery during your facelift, there are a couple things you're going to want to note in terms of post-care to take care of your incisions around the eyes. You will be given a ophthalmic ointment. It's Lacrolube, or sometimes it's under the brand Stye, and that it is an ointment that's made to go into the eye and lubricate the eye. After eye surgery, it's not uncommon to feel really tight and feel like you can't close your eye all the way, and that's just due to all the swelling. And then once that swelling goes down, that the eye can, and then the eye can close all the way, you deal less with dry eye. But in the beginning, you're gonna have like lubricating eye drops and some eye ointment that you'll use, and you'll kind of keep that around the eye at all times for the first 5 to 7 days. And we want to prevent the eyes from drying out. Because they will be irritated, and since they can't close all the way, that will help with those type of irritation symptoms. You're going to keep the sutures will remain in until post-op day 7, typically for eye surgery. And so we will be seeing you in the office periodically after your facelift surgery or eye surgery to remove the sutures. And depending on how quickly you're healing, will determine kind of the date on when we want to remove certain sutures. And for brow lift, the incisions are up in the hairline, so they're hidden in the hairline. And occasionally you'll have about 3 small incisions on the hairline. Those will be closed with, you will have some staples up in that area. It's the only area we really use staples, and that's to protect the hair follicle. And so we specifically use the staple closure in the hairline to prevent any unnecessary hair loss or damage to the hair. Those will be removed with the rest of your facelift sutures on post-op day 10. With brow lift, you can definitely expect to be bruised and have some extra swelling on the upper face, and that will subside within 1 to 2 weeks. If you decide that you will be getting a lip lift during your facial surgery procedure, the incision is right where the nose kind of meets the lip here. And we will remove those at post-op day 7. So there's a small incision just to kind of right under the nose there. It's hidden nicely in that crease that's naturally there. So we would remove those sutures. And for any of these incisions, you're just going to keep Aquaphor or Vaseline on the incisions after surgery. For your eye surgery, it is recommended to have you should have some artificial tears or lubricating eye drops, as well as the lubricating eye ointment. So having both is helpful. Typically for patients, it's easier to use the lubricating eye drops during the day, and then the ointment more at night, because the ointment can cause a little bit of blurry vision. It's a little less tolerable, but it's better for nighttime when you would be sleeping, and potentially the eyes would be a little bit open at night, and that they will dry out at night if you do not keep some sort of ointment on there. So having that on hand, getting those items prior to surgery is recommended to help with your eye incisions to heal and just that irritation that tends to occur. If you are having neck liposuction, Generally, you're going to have a lot of bruising and swelling within the first couple weeks as well. And we will want you to keep some sort of compression wrap under the chin, so everything, the skin can tone up and kind of heal up against the jawline. So you're going to keep a compression wrap that will be provided under the neck here, as much as you can in the first couple weeks, if not 4 weeks after neck liposuction. Occasionally after neck liposuction, the nerve can get a little bit irritated from the swelling and just from the procedure itself. The nerve can get a little angry, and it can occasionally cause a little bit of a asymmetric smile that is self-limited, and as the swelling goes down and as you continue to heal, your smile will, the symmetry will come back. But occasionally we like to warn patients that it is a possibility, and typically within a couple weeks it's completely resolved. For ice after any facial surgery, you want to be careful with placing ice packs directly on the face because the sensation to the face is not going to be completely normal after surgery. You can have some numbness in certain areas, so you don't want to run the risk of keeping an ice pack on for too long and potentially causing something like frostbite or damage to the tissues or damage to the healing area. So if you're going to use ice, you definitely want to wrap it in a towel or some gauze, and you will kind of periodically move the ice packs around, making sure not to over ice the face. It can help a little bit with post-surgery bruising and swelling. To keep it easy, we do have a device called AquaCool that any patient can rent for after their facelift surgery or after their facial surgery. And that device, just kind of, you strap it on, just kind of like the head garment, and it regulates how cool and how frequent the cooling is done, and that way it's a safe way to make sure that you're getting the ice onto the face and the cooling, but not damaging the tissues. So just ask anyone at our office if you're interested in the AquaCool device for your recovery.